Welcome to Demystifying Medicine, where I will discuss the alcohol path in the mind and the body. Today, we will be talking about what is an addiction, what is alcohol addiction, what causes alcohol addiction, effects of alcohol on the body and the brain, stages of addiction cycle, treatment options available, and the long-term effects of alcohol. So, what is an addiction? An addiction is a medical chronic disease that is connected with experiences you face, genetics, how your brain functions, and the environment. Individuals with addictions engage in compulsive behaviors and continue these acts of compulsion while knowing the consequences of their actions and how dangerous they can be. What is alcohol addiction? Alcohol addiction is a chronic disease that causes relapse to occur because an individual compulsively drinks. Alcohol use disorder is also known as AUD. Those with AUD face the ability of not being able to stop drinking, even while knowing the social and health effects. AUD can be on a spectrum of mild, moderate, and severe. Those referred to having an alcohol addiction are in the end of the spectrum that face moderate and severe alcohol intake. So what causes alcohol addiction? There are many factors that can cause alcohol addiction. These include social factors, genes, psychological, and physiological factors. Social and environment factors include individuals getting peer pressure into drinking, and if there's alcohol readily available, this can lead to an addiction, as well as living in poverty or experiencing sexual abuse can increase dependency on alcohol. The second factor is genes. Having a history of alcohol in the family can cause problems with alcohol and make you at a higher risk of being dependent on alcohol. Psychological factors include those that suffer from mental health or low self-esteem problems may rely on alcohol as an outlet to cope with their emotional state. And lastly, physiological factors. When someone drinks too much, it can cause changes physiologically to their body, and only drinking will be able to help relieve the pain they might be feeling.
Now let's talk about the effects of alcohol on the mind and how addiction begins in the brain. Alcohol has the ability to have a very pleasurable effect on the brain, and it can help shut off any negative feelings. Therefore, an individual that experiences feelings like this tends to drink it again to feel these feelings again and motivate the individual to keep drinking. For example, people tend to associate drinking with relieving stress, and though it may help reduce stress, it only helps temporarily. Eventually, people are caught up in this unhealthy cycle, which slowly affects and changes the functionality and structure of the brain. When the brain loses its functionality, it gets harder for the brain to control the drinking, which then leads to uncontrolled intake of alcohol. The effect of alcohol on the body. Alcohol addiction has many effects on the body. This includes the heart, the liver, lungs, pancreas, bones, muscles, and mouth. Now let's talk about the stages of addiction cycle. There are 3 stages in the repeating addiction cycle. The first one is binge/intoxication, 2 is the negative effect/withdrawal, and 3 is the preoccupation/anticipation stage. The brain regions that are affected in this cycle include the basal ganglia. This is involved in motor control as there are connections in this area that send signals to the brain to allow the muscles to move, and including voluntary movement in the body, which then helps to process emotions, form habits, and form motivations. The second is the extended amygdala. This helps to assess emotional value of stimuli that is sensory, and the last is the prefrontal cortex. This is responsible for planning and controlling our thoughts, feelings, and behaviors. The first stage is the binge/intoxication stage. In this stage, individuals that drink feel the effects that are rewarding, such as reduced amount of stress, happiness, and it is easier to communicate in social settings. Since the basal ganglia have a reward system, there is a constant trigger of this structure that causes an individual to keep drinking as a habit is formed and they are happy. The second stage is the negative effect/withdrawal stage. In this stage, individuals face many symptoms as they stop drinking, which include withdrawal effects including trouble sleeping, pain, anxiety, and feeling irritated. During this stage, individual drinks to escape from the negative feelings rather than to experience happiness and pleasure, and this uses the extended amygdala to experience emotional stimuli. Then the third and last stage is the preoccupation/anticipation stage. At this stage, individuals drink alcohol again after a period of abstinence. They start to look forward to the next time they will have a drink, and they are using their prefrontal cortex to help assess the situation to control their thoughts. Now let's talk about some treatment options that are available. These include behavioral therapy, medications, and mutual support groups. Behavioral treatment and therapy includes receiving counseling from a healthcare professional. Medications is where there are medications available to help alleviate relapse from occurring and helping to decrease drinking. And lastly is mutual support groups. There is a 12-step program that involves having sessions with your healthcare professional and peers that are also in a similar situation as you to quit alcohol. And they help you, support you, as they're in the similar situation as you. Now let's talk about the long-term effects of alcohol. The long-term effects of alcohol can include liver disease, damage to nerves and brain, and cancer in the mouth and throat, poisoning of alcohol, and then eventually leads to chronic disease. So now that you all have the preliminary knowledge and overview about alcohol addiction, I will now test your knowledge with the revamped version of What Would You Choose? Now let's go over some of the basic instructions. In this challenge, I will be showcasing examples of different scenarios, and based on the scenarios provided, I will be asking questions pertaining to the scene or image. You will then pause the video to try and come up with your answer. In the first scenario, we can see a guy named David drinking every day as he comes back from work and sits on the couch to drink. Day 2, we can see he is doing the exact same thing, coming back from work and drinking. And then we can see this routine continues every single day, every time he comes back from work. Now let's look at some of the multiple choice options. What spectrum does David represent? Is it A, severe, B, mild, C, moderate, or D, none of the above? Why don't you pause the video right here and attempt to answer the question and then play the video whenever you are ready. If you chose option A, then you are absolutely correct. He represents severe as he is drinking every day he comes back from work. Question number 2. Which stage do these symptoms pertain to and which one is incorrect? Some of the options that include in terms of the images is it pain, happiness, trouble sleeping, and irritated? Now let's look at some of the options. Is it A, preoccupation/happiness, B, negative/happiness, C, binge/happiness, or is it D, all are negative? Feel free to pause the video now. If you chose B, then you are correct. It is the negative stage, and happiness is the incorrect option because those symptoms begin in the binge stage. Question number 3. As we can see here, everyone is at the party enjoying while Alice is sitting here all alone until Alice goes and joins them. Question number 3. Which factor does Alice display? Is it A, physiological, B, genes, C, psychological, or is it D, social/environmental? You can pause the video right here and think of your answer. If you chose answer D, then you are correct. It is D, because she was peer pressured due to her environment and wanting to fit in, and because of how readily available alcohol also was, she was easily indulged. If you enjoy videos like these, please subscribe to our YouTube channel. Thank you.
If any of this information pertains to you, please consult these resources.